This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Rheumatoid arthritis is a crippling connective tissue disease that affects roughly 3% of the world's population. The pain is felt when the joint's lining, called synovium, becomes inflamed. This lining attacks and damages cartilage and bone. Women are 3 times as likely to be afflicted with rheumatoid arthritis compared to their male counterparts. Meanwhile, men are 10 times more likely to experience gout.
So to differentiate gout with the other arthritis, ito ay isang inflammatory arthritis, meaning it's a joint condition na meron talagang pamamaga.
Usually inflicting pain on just one joint at a time, gout affects about 1% of the population.
There is a genetic risk for those who have the predisposition to develop a gouty attack. No? So usually they have parents or immediate relatives who have a history of gout, and then they should have a high uric acid level. So nasa blood siya, usually tunaw siya nasa dugo, no? And then at some point, at a certain pH or a trigger like a food na kinain, it will crystallize in the joint, and then it will become a needle-shaped crystal that's very painful, and it will promote more inflammation around that area.
Although there are more than 100 variations of arthritis, it is possible to reduce its impact with early diagnosis and treatment and with regular checkup and exercise. What are the possible causes of arthritis? How can you take control of this debilitating disease? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Inocencio Alejandro, the president of the Philippine Rheumatology Association and a subspecialist in geriatric medicine and rheumatology. Also with us is Dr. Paul Santos Estrella, a doctor of internal medicine with subspecialization on rheumatology from the St. Luke's Medical Center. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Hi, good evening.
Good evening.
Tonight's discussion is all about arthritis.
Yes.
So let's start off by asking, what is arthritis?
Well,
Dr. Alejandro?
arthritis is when you have pain in the joints and you have inflammation.
And the pain in the joints and inflammation are different degrees.
Yes.
Am I correct, doctor? And leading into that, there are different types of arthritis. Dr. Santos Estrella, please tell us the different types of arthritis.
The common arthritis that we encounter will be osteoarthritis, rheumatoid arthritis, and gout.
So the osteoarthritis, please tell us a brief discussion of this type of disease.
Osteoarthritis
Yes, Dr. Alejandro.
is often found in the weight-bearing joints, like the knees. But sometimes in women, you may have them in the hands. And these are the women who come to us and they tell us, well, my hands are getting ugly and they have these little bony knobs that are present.
That's osteoarthritis. Is there a color that we watch out for when we have osteoarthritis?
It's more the bony swelling that we are looking for. It's classically not inflammatory, so you won't see the redness that you will notice in some of the other forms of arthritis.
How about rheumatoid arthritis, Dr. Santos Estrella?
When you talk of rheumatoid, you're talking of your immune system. Wherein, in contrast to osteoarthritis, this is more of what we commonly term as wear and tear. But for rheumatoid, we talk of the immune system. So there's a problem with your immune system leading to inflammation of the joints.
Okay, so is it the same manifestation of the swelling that was mentioned in osteoarthritis?
There's a difference in terms of location, whereas in rheumatoid arthritis, the commonly affected joints are the hands, or we call it the interphalangeal joints, the wrists. Usually the small joints are affected. In contrast to the osteoarthritis, these are the weight-bearing joints.
Is this more common? Is the osteoarthritis and the rheumatoid arthritis more common in men or in women?
Rheumatoid arthritis is more common in women, and gout is more common in men. Osteoarthritis affects mainly the older age group and those who are more overweight.
And you mentioned gout, Dr. Alejandro. Now let's talk about gout as a disease as well. It is also arthritis. Gout is arthritis. Am I correct?
Yes. Well, gout is one of the types of arthritis. And for most people, when they think of arthritis, they only know gout.
Yes.
But classically, it's called gout for a reason. So there's an acute attack. So somebody will tell us that they had too much to drink, too much to eat one night, and then when they wake up in the morning, then they could hardly walk because their big toe is red, swollen, and then mahanginan lang, talaga masakit na masakit.
So that is a distinct description or characteristic of someone suffering from gout.
That's
the
correct.
big toe.
Yes.
Okay. Why the big toe? Why is it the one affected, Dr. Santos Estrella?
The big toe, the description of that, you call it podagra. That is actually the classical description of a patient with gout. When a patient comes to us with that condition, most likely we know it's gout, especially if it's a female. Your question why it commonly affects the distal part, well, it goes with the mechanism of how gout affects the individual. The farther you are from the body, the colder your part of the body will occur, and usually that's where the uric acid will deposit.
You mentioned uric acid. What does uric acid have to do with gout? What is its role in gout?
Yes. Well, gout is a metabolic problem in the uric acid excretion. So in our foods and the product of our normal processes in the body, we have something called purines. And purines are converted to waste products. And people with gout, they tend to shuttle everything to become uric acid. And then, Dr. Santos Estrella mentioned earlier about cold extremities. This is where the salt precipitates, and that's the monosodium urate crystals. So what does uric acid have to do with gout? It causes the disease. And in most patients, the blood uric acid level is elevated among patients with gout.
From the VTR, what we saw earlier, the swelling of the joints, is that arthritis or is that already gout?
Well, one of the pictures that we saw earlier was a joint that is inflamed because of gout. And remember, gout is a type of arthritis.
Yes.
So there are more than 100 different causes of arthritis.
So does it necessarily mean that if you have high uric acid, since we're talking about uric acid, you automatically have gout? Dr. Santos Estrella.
There are a lot of individuals who have high uric acid, but they will not develop or they don't have gout, which is actually a common problem that we encounter. There are a lot of patients get treated for high uric acid, but they don't have gout. So if you don't have gout and just a high uric acid, essentially you should not be treated for the uric acid. But in relation to your question, uric acid and gout, try to imagine uric acid becoming a crystal, which is also tantamount to you break a glass, you grind the glass, and you apply it on your skin. Eventually it will abrade. So it's like using a sandpaper, rubbing it against your skin. That's how it affects the joint.
No wonder people who are suffering from gout always say it's very, very painful.
Painful,
The
yes.
pain is really unbearable. We'll talk more about gout, doctor, but first we have a caller on the line, Andrew Torres. Hi, Andrew. Good evening.
Yes, hello, good evening.
Hi, please go ahead with your question for our doctors.
Ako laging pain on my knees. Can this be because of the ligaments for playing basketball?
Pain and swelling in the knees.
Thank you,
and
Andrew.
Can it be caused by playing basketball? That's what I heard. Well, if you are young, we have to think of a sports injury first. So the ACL tear or maybe the meniscal tears, that's what we would like to think about. But if you are somebody who's older and you used to play and you hurt your knee, you remember there's one particular time that you actually hurt your knee, it might actually be osteoarthritis.
Okay, so that's just one incident. It doesn't have to be recurring.
It doesn't have to be recurring because the important thing in osteoarthritis is that you had an injury. So if you have an injury, in the body attempts to repair itself, but the normal tissue is cartilage. Alam mo yung sa chicken, when you the fried chicken leg?
Yes.
And when you eat it and you break it off, there's something shiny, like a little ball. That shiny little thing there is cartilage. Among people with osteoarthritis, that's no longer shiny. It's broken and sometimes it's actually naked, wala na yung cartilage. So among people who are injured, the body cannot produce more cartilage to cover it up. And then the only thing the body can make is bone. So when you have bone, then that's the osteoarthritis. So we see it in the X-ray as bone spurs.
Oh, so that is what is called a bone spur. But going back to gout, we mentioned earlier on in the discussion that it's more common in men.
Yes.
Why is it more common in men? And do women also get it as much as the men do?
Well, men are the classic examples of people who get gout. I'll address the question by saying we are thinking that it may be the estrogen in women that actually protects them against gout. So women, as they pass through the menopause, then they will get gout. So they will get the very similar symptoms as the middle-aged male does, yung podagra that we mentioned earlier. But there's another picture that's also common in the elderly women who gets it. So they may have it in the hands, and it may actually be confused for one other form of arthritis, which is the rheumatoid arthritis.
Yes. So Dr. Santos Estrella, Dr. Inocencio mentioned, Alejandro mentioned the rheumatoid arthritis in relation to gout and the difference. Please tell us more about this and the signs and symptoms of someone suffering from gout.
Typically, as mentioned before, you talk of podagra, which is the first big toe, which is a common symptom when a patient comes to our clinic. Those are the common. If you compare rheumatoid arthritis and gout, gout is an on and off condition. Many patients will come to us, Doc, I have very painful knee or very painful big toe. Then you will treat that. Most likely you will not see that patient for several weeks or months. Unlike rheumatoid arthritis, it's a constant problem for them. Every morning when they wake up, they have morning stiffness, they may have joint pains, joint swelling, tenderness. Whereas in gout, there is a period wherein they're okay. Then they proceed with their lifestyle. That's why, as Dr. Alejandro has mentioned before, you set aside the genetic issue, you set aside the hormonal issue, it becomes a lifestyle problem as far as gout is concerned.
And we will address that lifestyle problem when MedTalk returns. So Doc, when we come back, we'll talk about the one for in the lifestyle.
Did you know that fish oil has the ability to erase the agony caused by arthritis? Fish oil is effective in changing the inflammatory mediators in the joints. The best sources of polysaturated fat is cold water fish, such as sardines, salmon, and herring.
We're back here on MedTalk, still talking about gout. Gout is a type of arthritis, and on the line, doctors, we have Billy Sarmiento. Hi, Billy. Good evening. Hi, Billy. Good evening. Okay, maybe we can talk to Billy a little later on. Dr. Santos Estrella, you were telling us about the signs and symptoms of gout.
Yeah.
Please go ahead.
Yeah, as mentioned before, it's an on and off problem. You treat them for this period and then they're okay. Then after 3-4 weeks or a month or two, they come back with the same problem. And from those characteristics, we are able to make a diagnosis that yes, this patient has got because of that recurring pattern. Plus, of course, the ancillary tests that we are going to request, like uric acid, basic kidney function tests.
And those are the tests to determine if one does have gout. Well, but that is the only test that's tested for gout, that your tests can come out that you might have osteoarthritis or rheumatoid arthritis.
That's not the only test. Among patients with gout, actually the best test is to get some fluid out from the joint. And then we look for the crystals that I mentioned earlier, monosodium urate crystals. And they look like needles, and they are negatively birefringent.
What does that mean?
So you have a polarizing microscope, so it only aligns the light waves a certain way, and then there's a certain appearance, so it looks like a needle, and it's very, very shiny, and it's very obvious.
So it is confirmed upon seeing this very shiny needle-like substance that the patient has gout.
Yes.
Yeah.
Oh, doctors, we now have Billy Sarmiento on the line. Hi again, Billy.
Hello po.
Hi.
Hi.
Please go ahead with
Hi.
your question.
I'm just wondering, I'm experiencing something on my knee. Is it okay if I may be experiencing gout even though I'm just 18?
He's 18 and experiencing something on his knee. Thank you, Billy.
Okay. Well, I'm hearing two different things. One is I have knee pains, and do I have gout? And can I have gout at 18? Well, pain in the knees in somebody who is 18, gout is not the first thing I'll think about. However, among Filipinos, gout is actually very common, and even young people can have it. So we mentioned earlier that it's usually the middle-aged male, but I've seen people as young as Billy, 18, who have gout. But the picture that he mentioned earlier is slightly different. So this is one of the things that we figure out when we try to identify what type of arthritis the patient has. So we look at the pattern of the pain. So we heard earlier that gout tends to come in attacks. So you have it one day, and then the next day you're okay. Then for an extended period of time you're okay, then you feel like, okay na ako. And then suddenly you had too much to drink, or maybe you had too much to eat one day, and then you had another attack. And then this time, the patient learns to take some medicine, and then it goes away. Our fear is that most patients come to us when they already have bad effects from taking medicines, like they have an ulcer already, or their kidneys are shot because of the uric acid that deposits in the kidneys.
You mentioned medications now, Doc. If one has pain already, experiencing pain, and maybe has no time to go to the doctor, has no time to consult with the doctor, and takes painkillers, will that help? Or at the next attack, should they get a consultation already, Dr. Santos Estrella?
I guess for convenience, if you are having an attack, and there is no way for you to go to a doctor, and then you have an ordinary pain reliever at home, for that purpose of crossing the bridge, you can take it. But the soonest possible time that you can go to a doctor to determine the cause of the problem is very important.
It's also important to understand what is an attack like. How does one feel, and what are the characteristics, or how do we see that this patient has already swelling, or it's warm already to the touch?
In relation to the question of Billy, the two things that we might ask is there swelling on the joint? Is there limited range of motion? If there is none, as the question of Billy, and he's complaining of knee pain for an 18-year-old, without those symptoms, we might wonder, is this arthritis or is this soft tissue rheumatism, which is a different entity as far as we are concerned.
So the slightest pain in the joints, is it advisable to seek the help of your doctor right away?
Well, I think it is a good idea to see a doctor if you have pain that is prolonged, or if it's something disabling. So we mentioned earlier about the gout. If when you wake up and you have difficulty walking but you get better the next day, you should certainly go to the doctor at that particular time. Or if you have symptoms that tend to be there the whole day or last for several days, then it's time to go to a doctor and just make sure that it's nothing. I'd like to react to one of the questions earlier in terms of should I take medicine for it? I'm a bit worried about patients who have gout where it's actually going to get better even if you don't take anything. So if you just put ice on it, it's going to get better. If they take medicine and they say, oh, I got better because it just lasted a day. Tapos, maghihintay na lang sila nung the next attack. And it could happen many years after, or they will just wait until it gets from 1 day to 3 days to 7 days before they start seeing us.
And they shouldn't do that.
Yes.
You know, we speak of medications and treatments. We have a Facebook question in relation to that. What would work better for gout, Ibuprofen or Paracetamol?
Ibuprofen would work better because Ibuprofen is an anti-inflammatory, while Paracetamol is a pain reliever, but it's not anti-inflammatory.
So those are possible treatments
Yes.
for gout. Any other treatments that one can avail of to
At
relieve
home,
them of the pain?
If you have gout at
Yes.
home, you have to institute cold compress. Put ice. It's a common misconception. You put warm compress, you put liniment, you put methylated medication, but that is against gout. So as much as possible, keep it cool.
Okay, all right. And keeping it cool, we have another caller on the line, Eldwin. Hi, Eldwin. Good evening.
Good evening. How are you? Hello?
Yeah, hi, Eldwin.
Good evening. Let's see. My situation is every time I drink a lot at night and then I get just a little bit of sleep, the next day I feel pain, my hip joint, and sometimes it generates up to my middle knee. Would that be arthritis?
Thank you, Eldwin. Doctors?
I like to
Dr.
think
Santos?
it's not arthritis. Drinks for 2-3 bottles and unable to sleep. I would imagine having difficulty sleeping. He is an awkward place wherein there is less opportunity to sleep comfortably. Those are the circumstances that might lead to those pains that he is describing.
So if, for example, he identified the pain after a night of drinking, and if, you know, maybe on occasion he would drink and he would experience the same kind of pain, the same type of pain, should he go to a doctor?
This is where pattern is important, and I think that's what threw us off. Because he described something, the usual trigger about the eating, the drinking, but the location of the pain is different, and he talks about the hips. So I'm wondering if he's a little bit overweight. This is probably one of the soft tissue rheumatisms. So it's bursitis in the hip area, that could probably be it. What we're looking for in terms of the triggers, lower extremities. So feet, ankles, and then knees. Pero hip, medyo different. Kaya kanina, we were thrown off.
But that's still also a cause for him to monitor how he
Well,
feels.
cause for him to probably seek consultation, especially if it's something recurring.
So in seeking consultation here on the show, doctors, we'd like to ask for some tips for those who are already suffering from gout, how to manage their gout, and preventive tips as well.
Papasok ko yung mga masasamang barkada that I
Okay,
mentioned.
Doc. Yes.
Yeah. When you diagnose gout, sometimes we develop a tunnel vision and just focus on the gout itself. Gout is often merong mga masamang barkada. So, merong hypertension, diabetes, cholesterol, obesity, and people tend to be sedentary as well. And I don't know if most people probably know that individually these are risk factors for heart disease. So gout by itself is also a risk factor for heart disease. So when we make a diagnosis of gout, we take that as an opportunity to prevent disease by identifying these bad conditions early on so that we could initiate treatment. So in terms of treatment, most of the time it will focus on lifestyle changes, losing weight, becoming more active, paying attention to their food intake so that they don't eat too much, so that they don't gain too much weight.
Okay, thank you very much, Dr. Alejandro. Dr. Santos Estrella, any other tips? What food to avoid, maybe?
For me, it's very important to confirm that you have gout. Because if you don't confirm or you just think you have gout or because your lola said, oh, you have gout, iho, then you are put astray as to what decisions to make, what food to take, what medication to take. Once you are confirmed and your doctor or rheumatologist said, yes, you have gout, then it's time to change what you do, your daily activities, starting from diet, fluid intake, how much water you take, activities that you have to do. So everything is important in terms of managing patients with gout.
Okay, so thank you very much, Dr. Alejandro, Dr. Santos Estrella. Again, thank you once again to our doctors for enlightening us on the topic of gout. And gout is one of the types of arthritis. I hope we were able to help all of you understand and learn about that. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.